Shares of medical device makers, they're kicking off this week in the green, boosted on hopes of a potential reprieve from President Trump's reciprocal tariffs following his recent moves around technology. Our Bertha Coombs joins us now with a look at which American manufacturers are looking for that exemption. Bertha, good morning.
In short, Frank, pretty much all of them when it comes to medtech and devices and gear. They were all exempted from tariffs during the first Trump administration, but so far they haven't been. For companies like Airflow Health, which sells devices ranging from breast pumps for new moms to CPAP machines for sleep apnea patients, there's 145% tariffs on new shipment from China and 10% elsewhere. Could put the company in the red because they have little room right now to pass on price increases for their insured patients.
Right now, with the level of tariffs that we're looking with China, and businesses are going to be completely upside down on these products. So they can't pass those costs on to the consumer. It's going to be problematic.
Casey Height spent last week on Capitol Hill lobbying members of Congress for an overall medtech tariff exemption. But he wasn't the only one courting Washington. Thomas Allen, president of the New York-based Altor Safety, wants to see the tariffs for PPE actually stay in place. The company counts the government and FedEx as customers for its masks and respirators and gloves. But it's also hoping the new 145% tariffs on Chinese goods will help them expand their business when it comes to hospitals.
Quality of the American-made product is far more superior than the foreign imports because we follow the FDA and other regulatory bodies that a lot of the Chinese manufacturers do not.
So it does cost them more to produce those things. According to Boston Consulting Group, about half of PPE is made in China and another 15% or so in Canada and Mexico. BCG's Vikram Agrawal says demand may shift from China to lower tariff countries before it actually returns to the U.S., he thinks. Meantime, a lot of medtech, Frank, is produced here. But analysts at Canaccord Genuity note that companies like Stryker and Zimmer, they make like knee replacement, hip replacements. They have dozens of manufacturing facilities in multiple countries, and they can shift production to try to minimize tariff impacts. That is job one right now for the medical device makers. For many, that's going to include getting USMCA exclusions for the goods that they make in Mexico and potentially Canada, something they didn't have to do last time around. Back over to you.
Really interesting development, obviously a very critical part of the economy. Bertha Coombs, great reporting as always, and great to see you. Thank you very much.